Thank you so very much, and welcome to everyone. I'm so pleased to be able to think with you about a story I've encountered in my research, and this is the story of Babylon Health, which is a startup that contracted with the National Health Service, the NHS, between 2015 and 2023. So first I'm going to tell the story, and then we can spend a bit of time discussing what we think is at stake based on this story for public interest innovation and regulation. So the story starts here. In late 2017, I started to see advertisements for a new service while I was riding the tube. And they read, "Get well now," and "See an NHS doctor in minutes for free." The advertisements were for a service called GP at Hand. And it was one of the many products that a health tech startup called Babylon Health marketed and sold to the NHS. And all of these products, in some way, leveraged the idea of AI. In 2015, the company got the webcam contract for the Highland Surgery in Scotland, where the Daily Mail reported on September 20th, 2016, that patients calling in for an appointment were told that they could, quote, "see a doctor in minutes," if they used Babylon's service. The difference between this service and their regular GP was that these webcam services employed GPs from anywhere, provided that they were permitted to practice in the UK, and that these workers didn't have access to patients' medical records. That meant that they would usually only see them once. And that doesn't quite line up with some of the patient-centered aims of the NHS that focus on continuity of care. Nevertheless, GP at Hand expanded extremely rapidly, and by 2019 had over 50,000 patients registered. This growth was helped along by the ads I saw, and also by frequent press coverage about the company and its founder, Ali Parsa. Parsa was fond of talking up his rags-to-riches story as an Iranian migrant turned financier, and his commitments to, quote, "do with healthcare what Google did with data," end quote. These interviews often left out the fact that Parsa's previous healthcare company, Circle Healthcare, was the first private company to operate an NHS hospital. They got a contract for 10 years, but backed out of it when it still had a couple of years running, after questions about the standards of care at the hospital, and also after running up a £14 million deficit. By this point, Circle had already been taken public and had limited its liability to £5 million. So the NHS had to carry the remaining £9 million in debt. Fast forward to the story of GP at Hand. The Health and Social Care Secretary at the time, Matt Hancock, was quoted in the press describing that this was revolutionary and that he was becoming known for being an avid user of the service. In an Evening Standard special supplement published in late 2018 and paid for by Babylon Health, Hancock was quoted as saying, quote, "This technology allows more resources for people than people visiting GPs directly." This from The Guardian, November 30th, 2018. In October 2018, the Advertising Standards Authority banned Babylon Health from publishing the advertisements that I'd started seeing in 2017. This was based on the fact that signing up to GP at Hand did not mean that you would see a doctor immediately on the NHS. In fact, it meant that you'd need to change your GP practice, losing out on the benefits of attending the local practice and sometimes waiting several weeks to be re-registered with GP at Hand. The other part of the story here is that GP at Hand was actually a GP practice itself, registered in Hammersmith and Fulham in West London. But unlike other GP services, it only dealt with patients through these online appointments. Despite this, GP at Hand received the same payment from NHS commissioning groups that any other GP surgery would. That was, at the time, roughly £120 per patient. In 2020, the borough of Hammersmith and Fulham experienced a budget shortfall of £22 million. This was argued as being partly a result of having to finance the payments for this extremely large number of patients registered with GP at hand. And despite Matt Hancock's claims about being able to see GPs more frequently than at a regular service, an Ipsos Mori-backed assessment of GP at hand concluded that it mostly served younger, healthier patients, and that, in Hammersmith and Fulham at least, this was quite likely to mean that older and sicker patients were receiving less timely care and fewer resources. Well, why fewer resources? The bargain that underpins the funding of GP services is that, based on a flat rate per patient, the higher cost of serving higher needs patients will be balanced out by the contributions made by lower needs patients. But with so many people registered with GP at hand and so much funding from the clinical commissioning group flowing to that GP surgery, many other surgeries would have ended up with relatively more high needs folks. GP at hand, though, wasn't just about video appointments. It also featured a chatbot that Babylon Health suggested could do some of the work of diagnosis. This chatbot grew out of a piece of software that Babylon Health had pitched to a pilot test of the online version of the 111 telephone triage service. When they entered this pilot project competition, a headline in Digital Health magazine read, "Babylon is powering 111 with AI." Oddly enough, Babylon did not win the contract for providing the online service for 111. Nevertheless, the chatbot continued to get headlines, often referred to as a robot doctor. In 2019, it was announced that the chatbot had done better than humans in the GP exam. A team of doctors evaluated this claim and determined that the chatbot and the humans hadn't done the exam under the same conditions, but this had still resulted in more headlines for Babylon Health. In February 2019, over 10,000 people watched a video posted on what was then Twitter by user Dr. Murphy 11, aka consultant oncologist David Watkins. The video showed an interaction where Dr. Murphy 11 simulated a patient interaction from a 66-year-old woman complaining of a painful breast lump. No other symptoms were entered into the chatbot. The system asked whether the patient was pregnant or breastfeeding. And after a number of further questions, the app suggested that one of the most likely outcomes for this complaint was that the patient had osteoporosis, not breast cancer, for which painful breast lumps are a major symptom among this age group. Dr. Murphy 11 tweeted alongside his video, "The resulting list of possible causes is the product of a poorly developed, inadequately tested, unvalidated, and flawed decision tree." As the Times of London reported, Babylon Health responded by accusing Dr. Murphy 11 of trolling. However, in February 2020, David Watkins sat opposite the health director of Babylon Health on the BBC flagship Newsnight program. He pointed out that the symptom checker that he had tested and that so many people had viewed the video about had never been regulated by the Medicines and Health Regulatory Agency, or the MRHA. Indeed, it hadn't. While the presenter pointed out that the previous Babylon Health director had been quoted as saying, "No one has assessed how this thing works," the health director present on the set of Newsnight that night evaded the question. In reality, Babylon Health had claimed in 2018 that its software was a Class 1 medical device, which implied that it was doing a diagnosis, but that it had never been regulated as a diagnostic tool. By late 2020, Babylon Health announced that its its products were being reclassified by the Medicines and Health Regulatory Agency, with the regulator also investigating the company's overall governance. While this was happening, Babylon Health carried on pitching for NHS contracts, each bigger than the last. In January 2020, TechCrunch published a headline, "Babylon Health is building an integrated AI-based health app to serve a city of 300,000. This was the city of Wolverhampton, and this proposal was a piece of software that would integrate together digital health records from hospitals and patient complaints, integrating them into the same kind of diagnostic software as we were just discussing. In its reporting on the same story, the Daily Mirror quoted the Royal Wolverhampton Trust leader as saying that this service was as good as seeing a doctor. After only 2 years, this contract was terminated 8 years before it was due to expire, and with only 5,000 people in Wolverhampton ever having registered to use the service. On September 5th, 2023, Babylon Health went bankrupt. GP at Hand was sold, and the rest of the services wound down. So now my question is, what was happening with this company and with this story? There's many ways to read this, and the way that I read the story is that the aims of Babylon Health were misaligned with the aims of the NHS. In particular, Ali Parsa was famously known as being a fan of the software-inspired startup strategy called blitzscaling. Blitzscaling, which was made famous by Reid Hoffman, has 3 core aspects: growth, speed, and efficiency. Growth is sometimes described in startup language as number go up, refers to observable increases in measurable indicators such as investment, revenue, contract numbers, or employees. Speed involves moving a company more quickly into new markets or being able to show fast development of products. Efficiency includes making software that can be reused in different settings or sold in many different markets. A core aim of blitzscaling strategy is to generate investor interest in a company between rounds of fundraising in a venture capital system, with each round ideally raising greater amounts of capital that is then spent to repeat the process. Businesses operating in this mode are often created with the expectation that they will be purchased or absorbed by other companies within a few years. So if generating rapid growth of revenue, employees, and contracts is one of the main principles of blitzscaling, my view is that this helps make sense of the huge variety of ways that Babylon's products and services were talked about, particularly in the media, and why so many of the media stories focused on numbers getting bigger, from the GP at Hand patient numbers to the thousands of Wolverhamptonians who were supposed to be served with a new digital healthcare app. This also explains some of what Mansfield advisors mentioned in their own assessment of Babylon Health. They published a 2023 report that highlights the working conditions within the company, drawing on analysis of posts from employees to Glassdoor. One piece of employee feedback reads, quote, "You are expected to just build fast, i.e., do things quickly, even if we do not think they were scientifically rigorous or up to the standards we would have applied in our previous lines of work," end quote. Separately, a Wired magazine investigative report on Babylon's early development included a report from a user experience designer that they had stayed up all night, sleeping on the office floor the night before a BBC interview, trying to create an interface that looked like it was diagnosing something, even though it only worked on a very limited range of conditions. The growth in employees also meant a high turnover, which also meant a mismatch between making a reliable set of medical technologies and making a good story for the next funding round. So what can we learn from this story which is so wild that I have had to leave out a few parts to tell it today. Here are some lessons I think are important. One is that Babylon Health capitalized on the NHS's legitimacy and manipulated media visibility to stay present in public discussion long enough to move through venture capital funding rounds. Daniel Kampman, who wrote an LSE sociology PhD thesis on Babylon Health, also noticed something similar, and his work focuses on how the company specifically talked about and leveraged the idea of AI. Another lesson, which is perhaps more broadly applicable, is about what kind of innovation frameworks fit with the stated values of public services. Blitzscaling might be good for Groupon, and it might not be good for the NHS. Specifically, we can think about the NHS Constitution, which is the founding document for this service. This specifies a patient-centered approach and means that patients have a right to the best information. So a commissioning of a service shouldn't occur before a diagnostic product has had regulatory approval. Moving fast and breaking things might seem to justify regulatory evasion for the benefit of gaining investment and growing a business, but not when lives are on the line. There are also risks of what's called epistemic injustice, which occurs when automated systems don't include information from minority groups, which we can see in the examples that Dr. Watkins tested out, where different kinds of age, gender, or even ethnic background considerations will profoundly change a diagnosis, and where a clinician's experience and specific expertise might actually make more of a difference. A third lesson might touch on what knowledges and practices are influenced by an over-focus on growth, speed, and efficiency. Babylon's growth model had negative outcomes for clinical labor. It helped to create a precarious gig work model for clinicians, performing GP appointments on demand. This has had a knock-on effect for patients of undermining continuity of care, and now that online consultation is more widely offered, especially by the private healthcare sector, pay for clinicians working online has gone down from the high levels that it was at in 2018. The final lesson is about aligning innovation with existing expertise and knowledge. The Glassdoor reports on the Babylon working culture are familiar to me as someone who's worked in tech sectors for years, but they're chilling when I think about healthcare. Expert knowledge is essential, and so is the tacit knowledge and contextual knowledge gathered from working in particular places, like with specific patients in a specific setting. Now is the part where I want to hear from you. I'm looking forward to us thinking together about what lessons Babylon Health can give us for our public service delivery and beyond. Thank you.